Well, welcome for joining welcome tonight, and we're so grateful to Sally Casella, who is one of our nurse leaders and really the heart of the Norma Freeman Breast Center here in um, Trumbull, for organizing this cancer survivorship series. She is very connected to our patients and has um, been for quite some time. And she asked me tonight to talk about caring for yourself after a diagnosis of breast cancer. So, when we think about breast cancer incidence and survivorship, we really think about the phases of care, the experience of women as they are screened for, diagnosed, or treated for breast cancer. Um, this is the cancer survivorship continuum as defined in the National Academy of Medicine report delivering high quality cancer care that was published initially in 2013. But this cancer continuum really has come to define both how we do research into cancer types and also how we think about treatment. And so tonight we're going to focus on this, divide our talk up based upon this cancer survivorship continuum. Breast cancer is the most common cancer of women in the United States, accounting for about 30% of all cancers in women. In 2025, we estimate there will be 316,000 cases of invasive breast cancer in the United States, um, and with a relative 5-year survival of over 90%. So, breast cancer is a very curable cancer. Um, this graph demonstrates the rates of breast cancer over time, where they have held relatively stable, and breast cancer mortality, which continues to decrease. And the difference between our rates of incidence and mortality is the success of our screening treatment and cure. Again, breast cancer survival, when you take all comers, is greater than 90%. It's great to see it graphically, to know that most women with breast cancer um, will achieve a cure. We know that the likelihood of cure is really related to stage at diagnosis. And women who are diagnosed with early stage localized disease have very high rates of long term survival. Regional disease, which would include positive lymph nodes, also have a high rate of cure. And then women with metastatic disease or distant disease um, have lower rates of long term survival. And again, just another way of looking at this relative success that we have with breast cancer screening. We know that 64% of women are diagnosed with localized or early stage disease. Another 28% was spread to regional lymph nodes. And this group, the majority of that pie graph, are the women who have um, the highest rates of survival, averaging at 90%. This is one of a number of studies that have looked at the experience of breast cancer screening on breast cancer survival. And in this graph, you can see in the top line here that women who undergo regular breast cancer screening have a 90% survival. These women who are diagnosed at the earliest possible stage. The next line with the green triangles are women who develop cancer in between their screening intervals. So these are typically more aggressive or faster moving tumors that where women will develop symptoms in the year after a normal screening mammogram. The orange line at the bottom here are women who have never undergone screening. So again, this is more evidence that of the value of screening mammography for to diagnose women at the earliest possible stage, and to ensure the best outcomes. So when we think about how to care for yourself with breast cancer, it's about caring for yourself before we're even diagnosed. And that is making sure that we're all getting annual screening mammograms and also having regular breast self exams and an annual clinical breast exam with our physician. Once we have screening imaging and have an abnormality, most women will then undergo a diagnostic image guided biopsy. The standard of care, of course, is to have a biopsy before any surgery is completed. An image guided biopsy can be completed under ultrasound guidance, mammogram guidance, or MRI guidance if MRI was used as part of the screening plan. And then after a biopsy, there will be a pathology report. In the pathology report, the type of tumor will be described along with the tumor grade. Grade 1 is the best differentiated, the most normal looking cells. Grade 2, they start to appear a little more abnormal, and grade 3 are the most abnormal appearing cells. Grade 3 tumors are faster growing and tend to be of a more aggressive type requiring more therapy. Also in the pathology report will be the breast cancer receptors or biomarkers. These receptors on the cell surface determine what will control the cell's growth. There are 3 receptors that we evaluate. The estrogen receptor and progesterone receptor are the female hormones. The other receptor is called HER2, which is a marker of a very specific cancer that we treat with targeted molecular therapy. And so the breast cancer stage is determined by a combination of factors. It includes the estimate of the tumor size based on the imaging findings and the physical exam, the lymph node status, also determined based upon physical exam and the imaging findings. We will look for metastatic disease if a patient has a symptom. Otherwise, there's usually not a reason to do scans for metastases elsewhere in the body at the time of diagnosis. Then we look at the tumor biomarkers, the receptors, the estrogen, progesterone, and HER2 receptor, and the tumor grade. These are all then put together to determine the tumor stage. So once you've been through screening and imaging and have a diagnosis of breast cancer, it's time to gather your team to then identify your sources of social support to help walk you through the process of breast cancer treatment and into survivorship. Your team might include family members, friends, spiritual advisors. It could be coworkers, supervisors, or mentors. Can include your healthcare providers, patient advocates, other cancer survivors, support group members. I included this picture from when I was treated for breast cancer in 2016. This is as I'm getting ready to roll back to the operating room, and my daughters, my son, my sister were all there with me on that day. This is my daughter, Eleanor. The benefits of social support in breast cancer treatment and outcomes are very well documented. Several studies have looked at different types of social support and the benefits that they offer. Social support is clearly linked to reduce anxiety and stress, reduced fatigue, and reduced experience of pain. Social support is also linked to improved ability to cope for feelings of control, improved mood, self-image, and sexual function. And social support has a long-term association with improved physical well-being and ability to perform daily tasks. So consider all the help that is available to provide support as you go through treatment planning and treatment and survivorship for breast cancer. The kinds of help that are available can come from family and friends, can come from a patient navigator. We have on-site patient navigators in all of our treatment sites, but there are also patient navigators that are available from national organizations, including um, uh, organizations like the Susan Komen Foundation, where they have navigators available um, uh, for consultation at their website. It's always important to consider the costs of cancer treatment and uh, other opportunities for support include a financial counselor. It could be a physical therapist, fertility specialist, a physical trainer, a massage therapist, support with house cleaning and child care, acupuncture, music therapy, and other integrative mental therapies. Most important thing is to be willing to ask for help. And so after you've uh, gathered your team and identified social support, then you move into the phase of shared decision making or making a treatment plan. I'm going to stop my share for just a minute and see if there are any questions. Um, I'm looking at the chat. I don't see any chats yet, any questions in the chat yet. So if there are any questions, don't hesitate to put them in the chat. I'm going to go back to sharing my screen. Okay. Um, so we know that multidisciplinary care is associated with improved outcomes in breast cancer treatment. Multidisciplinary care includes a coordinated team of professionals dedicated to the treatment of women with breast cancer. The multidisciplinary team can include a breast surgeon, a medical oncologist, a radiation oncologist, a pathologist, a breast radiologist, a patient navigator, our outpatient clinical nurses, and all the supportive services that we just discussed. The improved outcomes associated with a multidisciplinary team include improved time to treatment, the receipt of guideline concordant treatment, improved patient satisfaction, and improved overall survival. And at the heart of the multidisciplinary team and that model is shared decision making. For every treatment that is provided, it is a decision that is made in uh, a shared format amongst providers, patients, and their support, whether it's their family or their friends. So the patient and family's goals and preferences, the provider's clinical experience and expertise, what science has to offer um, in terms of making a treatment choice, and then the biological, psychological, and social context. Things like where you live, what resources are available, how old a patient is. Um, those will all come into play as we make a decision uh, in a shared way as a team. In this context, you'll make a treatment plan. And the treatment plan for breast cancer includes both local regional treatment, managing the cancer in the body where it is, systemic treatment, preventing the development of cancer elsewhere in the body. It will include a consideration of genetic counseling and testing and fertility preservation. Local regional treatment can include breast conservation, which could be a lumpectomy or a partial mastectomy, removing the area where the cancer is with a clear margin, or a total mastectomy, removing all of the breast tissue. The lymph node surgery might include simple lymph node sampling or an axillary dissection where all the lymph nodes from underneath the arm are removed. Increasingly, our lymph node surgery may be no lymph node surgery needed at all. Part of breast conservation is the use of radiation therapy after lumpectomy to help reduce the risk for local recurrence. Systemic therapies could include hormone therapy, which are estrogen blockers. These are drugs like tamoxifen or anastrozole. Targeted therapies that include monoclonal antibodies like trastuzumab for HER2 positive cancer. A new class of drugs called tyrosine kinase inhibitors, cyclin-dependent kinase inhibitors, immunotherapy, or, or standard chemotherapy agents like cyclophosphamide or taxotere. So once you've brought together you've identified your social support, you've brought together your multidisciplinary team, and through shared decision making, you've put in place a treatment plan, you'll begin treatment for breast cancer. That may be surgery as the first course of treatment, or it may be systemic therapies as the first course of treatment. As you go through treatment, a big part of self-care is managing the symptoms related to treatment. I'm going to stop for a minute. I see there's a question in the chat. Can you talk more about systemic therapies and when they might be useful or appropriate? Happy to. Systemic therapies will be recommended for every breast cancer treatment plan. There will not be a time when we don't recommend some systemic therapy for an invasive breast cancer. The only time we would not necessarily recommend systemic therapy might be for ductal carcinoma in situ, which is non-invasive disease. The systemic therapies will be tailored to the stage of the disease and the biology of the tumor. And so for early stage estrogen receptor positive cancer, we might recommend estrogen blocking therapy, a drug like tamoxifen. For a HER2 positive cancer, we would recommend, if the tumor is bigger than 5 millimeters, we would recommend chemotherapy that would include HER2 targeted antibodies. And so the systemic therapy would be recommended for every invasive breast cancer. And then the type of therapy is really tailored to the stage of the disease and the biology of the tumor. Happy to talk more about that or answer more questions. I'm going to move on to symptom management. And so self-care during treatment is really about managing the symptoms related to the treatment. These symptoms really focus on pain, anxiety, nausea, insomnia, constipation, and fatigue. Based upon the systematic review of the literature, the Society for Integrative Oncology recommends integrative therapies that can help you manage those symptoms. As you go through treatment, your provider, whether it's your medical oncologist or your surgeon or your radiation oncologist, will have recommendations and provide support for symptoms related to treatment. These are additional integrative therapies that can be considered for symptom management. For pain, you might consider acupuncture, Reiki, or hypnosis. This is in addition to pain therapies that might be prescribed by your providers. For anxiety, there is evidence that supports the use of music therapy, meditation, stress management techniques, and yoga. Nausea can be also managed with acupuncture and yoga. Insomnia, which I hear a lot about from patients, can be managed with sleep hygiene techniques and yoga. Yoga is good for just about all of it. Constipation can be managed with Reiki and acupuncture as well. Fatigue is best managed with exercise. I know that seems counterintuitive, that when you're most fatigued, that exercise can help, but the data on that's very clear. For depression or depressed mood, meditation, relaxation, yoga, massage, and music therapy are effective. And for neuropathy, acupuncture can be helpful. So now that we've talked a little bit about symptom management during treatment, I want to talk now about breast cancer survivorship. The National Cancer Institute has defined breast cancer survivorship or breast cancer survivors as individuals from the time of diagnosis through the balance of their lives. So 2 years after I was treated for breast cancer, my daughter and I did a backpacking trip in the Alps in Europe. This was to celebrate my survivorship and her 30th birthday, and this is a photo from a part of that backpacking trip. And so, what are the components of breast cancer survivorship care? There are 4 key components of every survivorship visit. Survivorship really starts at the end of active treatment and extends for 5 years. The components of survivorship care include monitoring for breast cancer recurrence, monitoring for the late effects of treatment, supporting adherence to ongoing treatments, and health promotion. And just take a quick look at the chat and see if there are any other questions. Okay. So I'm showing you the National Cancer Center Network guidelines for survivorship care. These are the guidelines for best practice that um, define what we do and how we provide survivorship care. These guidelines are developed by an expert panel based upon review of the available scientific literature. And so, again, just to reiterate, the cancer survivorship focuses on surveillance for cancer spread or recurrence and screening for subsequent primary cancers. Monitoring for the long-term effects of cancer, including psychosocial, physical, and immunologic effects of the cancer itself. The prevention and detection of the late effects of cancer and cancer therapy. I see there's a question in the chat of what do you consider the late effects of treatment? We're going to jump into that now, but with regards to breast cancer, this can include neuropathy related to chemotherapy, lymphedema related to surgery and radiation, depression related to the trauma of cancer treatment. These would all be considered late effects. Evaluation management of cancer-related syndromes, coordination of care with the primary care provider to ensure all breast cancer survivors' health needs are met, and planning for ongoing survivorship care. So, in monitoring for breast cancer recurrence, we can talk about screening for local recurrence. Many women ask, don't I need a mammogram more often? And the answer is no. Screening afterwards is an annual mammogram is adequate. A clinical exam, though, is equally, if not more important than screening imaging. The clinical exam it would include a clinical breast exam if there's been breast conservation, an exam of the mastectomy site and the reconstruction. And those should occur at 6-month intervals for 5 years. Screening imaging can include a mammogram and an ultrasound, or a mammogram alone, depending on if you have had breast conservation or not. For young women or women with dense breasts who have breast conservation, we might recommend screening with a breast MRI. That screening plan will be tailored to every patient. We also look to monitor for symptoms and signs of distant recurrence. That's done with clinical history and exam, and screening imaging only when appropriate. Our evaluation for the late effects of treatment are really specific to the cancer stage, the tumor biology, and the treatments that have been received. And these might include clinical exam, labs, testing, or imaging. So this monitoring for the late effects of treatment and for recurrence is complex. And this is an example of a rubric that we would use. This one is the one that is recommended by the National Cancer Center Network for monitoring cancer survivors and for evaluating for symptoms related to treatment, cancer effects and treatment effects. They include monitoring for cardiac health, anxiety, depression, and trauma, cognitive function, fatigue, lymphedema, pain, hormone related symptoms, sexual health, fertility, sleep disorders, monitoring for a healthy lifestyle, immunizations and infections, and employment and return to work. Here's an example of a fatigue assessment. And so the kinds of things that we can do when patients report fatigue, it would include a history and physical exam, an evaluation of disease status, looking at contributing factors to fatigue, screening for emotional distress and sleep disturbance, a laboratory evaluation, and other diagnostic testing to help sort out the issues that related to long-term fatigue. Here's another example of the evaluation for lymphedema. We're going to talk a little bit more about this. Women who have axillary surgery have a 10% risk of lymphedema if they have sentinel lymph node biopsy only, can be up to a 30% risk for lymphedema for women who have axillary dissection. And so screening and for lymphedema is an important part of what we do at survivorship follow-up visits. Once we identify a concern, we have ways of working it up and then referring for treatment that includes both specialized physical therapy, wearing a compression sleeve, or possibly even reconstructive surgery. Lymphedema can be associated with any axillary surgery. The risk of lymphedema increases with the extent of surgery, with related to obesity, diabetes, someone who's smoking, someone who has a history of pre-existing lymphedema, and for patients who receive radiation therapy. The important thing to know is that the most common time to develop lymphedema is 18 months after the initial operation. Lymphedema often does not happen right away. Lymphedema can occur in stages where the arm only appears mildly swollen, maybe rings don't fit on fingers, or a watch leaves an impression. Stage 2 lymphedema is managed easily with elevation. And then stage 3 is when permanent swelling develops. Stage 4 lymphedema can be associated with significant skin changes. So screening for lymphedema can include a physical exam, monitoring of symptoms, limb measurements, or the use of bioimpedance, which is what we use in our practice here. Bioimpedance is using a small electric current and looking at resistance to flow of that electric current. If we see that change over time, we know that patients are developing lymphedema, and we may be able to identify lymphedema before patients ever have symptoms. Treatment for lymphedema, as we mentioned, includes physical therapy with a specially trained lymphedema therapist and wearing a compression sleeve. More severe lymphedema can be treated with a lymphedema pump or with wraps. So now that we've talked a little bit about survivorship, which is a huge complex topic, we can move on to the 5 things that we can all do every day to help reduce our risk of cancer recurrence. So our survivorship healthy habits are 5 things that we can do. Number 1 is a plant-based diet. Number 2, limit alcohol. Number 3, maintain a lean body mass. Number 4 is regular exercise. And number 5 is smoking cessation. So the plant-based diet, this is really a Mediterranean diet, focusing on fresh fruits and vegetables, at least 5 servings a day, healthy grains, and healthy proteins. So we know that one of the sources of estrogen in our diet comes through meat and dairy. And so making sure that we limit that, and when we have meat or dairy, that it's not treated with hormones. The American Institute for Cancer Research is the most authoritative website on cancer risk and nutrition. It has a wonderful resource for how to set up your kitchen, for recipes, for cooking classes. They currently have the Healthy 10 Challenge, which is this 10-week interactive program to kind of help build healthier habits around nutrition and everyday diet that is simple and easy to achieve. This is really the best and most authoritative resource for nutrition and cancer. Eliminating alcohol is also essential for cancer risk reduction. The Nurses' Health Study found a 70% increase in breast cancer among women who reported more than 3 alcoholic drinks per week. The most recent Surgeon General's report has really identified that there's no level of alcohol consumption that was not associated with an increased cancer risk. We know that alcohol consumption is associated with an increase in circulating estrogen levels, which is a risk factor for estrogen receptor positive breast cancer. And so there is really no safe level of alcohol. We know that keeping alcohol consumption to less than 3 drinks per week should help reduce your risk of both developing breast cancer and breast cancer recurrence. Regular exercise. This could be a talk in and of itself. I'm seeing a question in the chat. How about fish and seafood? So fish and seafood is an excellent source of protein with not a significant cancer risk associated with it. Um, uh, there's always this question about sugar and cancer. Does sugar feed cancer? We can't say that it's sugar by itself, but we know it's excess calories that can be associated with cancer risk. And so making sure that food has nutrients and as few calories as possible, as in fruits and vegetables, that can be most associated with cancer risk reduction. And I promise at the end, I'll go back to the AICR information in that link, the American Institute for Cancer Research. With regards to exercise and cancer, I could talk about that for quite a while. So I just wanted to summarize in one slide that there are several large multi-center trials that have demonstrated the benefit of regular exercise in reduction of risk for developing breast cancer and for the prevention of breast cancer recurrence. Current recommendations is for at least 30 minutes of exercise 5 times a week. The most recent large trial in colon cancer that was in the New England Journal of Medicine just this month found that a combination of both aerobic and exercise and weight training was the most effective in preventing cancer recurrence in patients with colon cancer. So we just can't emphasize enough the importance of regular exercise in cancer survivorship. I'm not great at this myself, so I have to improve my habits there. The next is maintain a lean body mass. So increased body mass index is associated with the increased risk of cancer recurrence and mortality in several large epidemiologic studies. The increase in mortality ranges from 30 to 70% in most studies. Increased BMI is also associated with the increased risk of developing breast cancer, but really for postmenopausal women only. In studies that have been done in cancer risk in premenopausal women, BMI or body mass index does not seem to play as an important a factor as in postmenopausal women. The current recommendation is to maintain a healthy weight with a BMI less than 30. And at last, smoking cessation, which I'm not going to say a lot about. We do have smoking cessation programs that we refer patients to and other resources that are available through the American Cancer Institute for smoking cessation. And so here are a list of survivorship resources that are available um, for cancer survivors and for healthcare professionals. This is all available through patient resources from the National Cancer Center Network. The website for the AICR is here, the American Institute for Cancer Research, which again I think is a very well designed and very authoritative site for information on nutrition and weight management in cancer. The American Cancer Society has wonderful resources available, as well as all of these other organizations, including Livestrong. So, caring for yourself after a breast cancer diagnosis. It starts before you're diagnosed with an annual screening mammogram and self exam and clinical exam to make sure cancer is diagnosed at its earliest possible stage. Once you have a cancer diagnosis, gathering your team and developing your resources for social support. Then, identifying your clinical team and developing a treatment plan with shared decision making. Managing the symptoms of cancer treatments as you're going through active treatment. And then survivorship care, which we discussed, including monitoring for recurrence and the late effects of treatment. And then the 5 things that you can do every day to help reduce your risk of cancer recurrence. I've been talking for a while. I'm going to stop and see if there are any other comments or questions. I'm seeing everybody in the chat. I'm going to stop my share. I have to say, my family have been some of my best advocates as I have gone through my treatment for breast cancer and in my survivorship. And I feel very fortunate that I have such engaged, loving family members. Well, if there are no other questions, um, I think we'll end this. And I really appreciate the opportunity to have this conversation tonight. And hopefully next year we can do something in person. Again, thank you to Sally Casella. Um, oh yes, Danielle, thank you for mentioning Thrive, which is a organization that has been spearheaded by Dr. Neil Fishback, one of our medical oncologists here, to provide a resource for cancer survivors in our community here in Trumbull. Um, it provides exercise classes and a workout room and other support services, and it's a really dynamic, engaging place. So, thank you for mentioning that.